GBB Freeport.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
Good evening. You're listening to Healthy Living Radio, dedicated to bringing you the latest advances in health and wellness so you can live better, healthier, and longer. I'm your host, Dr. David Scharf. Today's topic, how small changes in your smile can make a big difference. Our guest on tonight's show is Long Island's go-to dentist for cosmetic dentistry, Dr. Steve Rogers. Steve, welcome to the show.
Thanks, Dr. Scharf. Thanks for having me tonight.
I really appreciate being on the show. We get a lot of questions from our listeners on cosmetic dentistry, smile enhancement, that sort of thing. So let's just start off. Tell me, I hear the phrase a lot, smile enhancement or smile makeover. What does that mean?
You know, David, today we have so many ways of making people look a little bit different, to make them look the way they feel. We're using different photography, we're using comprehensive examination, and we're making people feel the way they feel they should look.
So if someone doesn't like their smile, they don't have to be stuck with their smile anymore. They can come in and they can improve things.
That's right, David. Today we have all those new techniques to make people feel
young again.
Thanks.
So just tell me a little bit about your practice, where you practice, where you went to school, that sort of thing.
Yeah, I went to school. First I went to school in Florida as a young person, and then I went to the University of Pennsylvania, where I went to dental school. Upon completing dental school, I went to do a general practice residency, and I chose Kings County Hospital in Brooklyn. I was interested in doing some advanced surgical techniques, and I learned a lot there.
Mm-hmm. I know we were talking before the show also that you told me you had taken quite a few advanced courses in cosmetic dentistry. Is that something every dentist does, or do you need to be... can anyone do cosmetic dentistry? Tell me about that a little bit.
You know, Dr. Scharf, when you finish dental school, you're ready to learn dentistry. I traveled all over the country following the leaders in dental education at the time, and we still have to continue. In order to be a good cosmetic dentistry, you have to continue all of your educational skills.
I would imagine everything's always changing, materials, techniques, all that sort of stuff.
Yeah, we embrace them and we enjoy them.
Mm-hmm. And where's your practice?
We practice in Massapequa. Mm-hmm. We have a large practice. I have 2 partners. Our facility is open 6 days a week, and that's how we feel we can best serve people.
Well, very good. So let's get into it. Who's your typical patient that comes in for cosmetic dentistry or smile enhancement? What are the types of patients that you see for that?
My typical patient is a patient that's been referred by one of my patients. But as far as just a typical person, we treat firemen, we treat policemen, we treat business owners, we treat people from Wall Street. Everybody has their own needs. But most of the people that come to our office are looking for something different. Mm-hmm. We have a very comprehensive atmosphere. We have a staff that is truly highly trained, and we like to think of our patients as guests.
So, I mean, from what you're saying, cosmetic dentistry is really for every man. It's not something that's, for the uber wealthy or the hedge fund managers. It's really something that's within reach of anybody.
Yeah, I think those ideas that nobody can have those things is a thing of the past. Mm-hmm. We have different levels of cosmetic dentistry, from porcelain restoration to bonding, and all these have different associated costs.
Mm-hmm. When did you know you wanted to be a dentist?
Oh, I was probably in my 3rd year of college. I always thought I would be a physician. And I was working in a hospital at the time, trying to get as much experience as possible. And I just didn't do well with sick people. So someone referred me to a dental clinic at Stony Brook, and I said, "What? A dental clinic?" And I went there, and it really opened up my eyes. Mm-hmm. I saw, doctors treating people that were happy, healthy people, and they were doing good things for people.
Mm-hmm. Who's the typical patient that you see? I mean, I would imagine you see people along a broad spectrum of issues. So who's the typical patient that comes in? I mean, do you see people who are haven't been to the dentist in 30 years, or most of the people who have this sort of treatment done, people that have always kept up and just want a little enhancement? Who's your typical patient in that respect?
You know, David, I don't know if there's a typical, but most of the people that come to my office come because they're looking for something different. They're looking for an office where they can be treated differently than they are in, say, typical medical offices today. I don't know, when you go to a medical office today, often they'll ask you to sign in. Our staff knows who's coming to our office. We don't refer to our waiting room as a waiting room. It's a reception area, so that your time is reserved for you.
What do you think? What do you think is the biggest barrier that keep people away from the dentist? When you see someone that hasn't been to the dentist in 10 years, 20 years, what's the main reason those people stay away, have you found?
Well, a lot of those people, once they feel they've missed a year or 2 years, they try to back burner everything, and they're afraid of what they're going to find. And often people come in after doing that, and really things aren't as bad as they thought.
Do people ever come in feeling embarrassed? Do you think that they've maybe neglected their mouth and they feel like they're going to get yelled at the dentist because they didn't come in or they didn't keep up with things?
Dr. Scharf, we see that all the time. Most people, when they come to a dental office, are embarrassed. It's a very personal thing, and a lot of people aren't prepared right away to meet somebody new. But once they meet me or my staff, they're usually pretty comfortable quickly.
Mm-hmm. So what's the process? Walk me through the process. I'm sitting home. I'm thinking about getting my smile improved. A friend I see a friend at work. You did her smile. I come in. I want my smile to look like her. Take me through the steps that a typical patient would experience to have their smile addressed in your office.
Sure. The first thing we do is we sit down in my conference room. We don't go right away to the treatment room. We try to review the things that are important to them. Then we'll walk into the treatment room, and the first thing we start with is photographs. When we take a photograph, immediately we put them up on the screen, and we want to discuss what they're talking about, what would make their smile special to them. Mm-hmm. And then we can follow up with health history, x-rays. We use all digital x-rays to limit the amount of radiation.
So if I come in and I don't like my smile, do I have to be able to articulate to you what I don't like about my smile, or can I just say, Dr. Rogers, I hate when I smile? And can you fix it? How involved is the patient in the process of designing their new smile?
On our website, we have before and after shots of cases that I've actually completed. And I can take patients through all of these patients and show them how they're different and how they're the same and how they can relate to them. We also have a book that's really a smile book. And we have some famous people in there. And we can show them why some people look feminine or why some men look very masculine. And this could help them pick what they would like. Mm-hmm.
Do you ever do any imaging? Can people ever see what their smile is going to look like before they even get started?
Well, with photography, there are companies you can send the photo out, and you can replace their teeth with other teeth. Also, we like to do a lot of wax-ups. We take models of their existing teeth, we send them to a laboratory, and the laboratory has artists. And these artists design a smile. If a patient likes that smile, sometimes we can actually transfer that to their mouth temporarily so that they can actually see it and feel it.
So they can smile, they can take a test drive before you install that smile permanently.
And sometimes we even encourage them to bring in family members or someone that's important to them to help them decide. It's a lot to think about at one time when you're changing a smile.
Mm-hmm. So basically it sounds like you're saying I can have as much or as little input as I want. I can say, take over and make it look beautiful, or I can be involved every step of the way, really, in choosing the nuances of what I want.
That's true. And often with my partners, it's a team approach. So we'll get them involved as well.
That's a nice option to have other dental eyes take a look all in one facility. A question that I get a lot of times from people involves bleaching. So we hear so much about different bleaching things. There's bleaching toothpaste, there's white strips, there's Zoom, there's Gloom, there's Doom, all these things that you can have in the dental office. There's trays. Take me through, why would somebody choose one versus the other? What are the differences in all those bleaching systems? In other words, why would somebody come to the office to have their teeth bleached versus just using a whitening toothpaste? What are the differences?
I don't think the whitening toothpastes are going to make that much of a difference. They help keep the teeth clean, but they're not going to bleach your teeth. The white strips work very, very well with young people. Sometimes we find people after some orthodontics, and they just use the white strips. They work great. Mm-hmm. The tray system seems to be the most effective. We have different levels of bleaching, strengths from 10% to 22%. And then sometimes we incorporate what we call the zoom system. That's where we use a light in addition to the gel, where the gum tissue is totally protected. But often we don't use this as a standalone system. It works best with the trays. So in order to get the most out of it, we use the trays first, then we use our zoom system, and then sometimes we even continue with trays, and we can get super results.
So if someone's tried white strips at home and hasn't been satisfied with the result, should they assume that their teeth can't be bleached, so then it's time to go to the next step and do something like a tray or a zoom bleaching?
That would probably be the best idea.
And what types of situations don't respond? So take me through the next step in the spectrum. So you have a patient who doesn't like the shade of their teeth, and can you ever look at someone's teeth and be able to say, you know what, bleaching isn't going to make you happy, you need something else? How do you know that?
Often with previous bonding or previous porcelain restorations, it's very hard. You cannot really bleach those restorations. Years ago, we used to see a lot of people with tetracycline staining. We don't see as much of that anymore. But those cases really don't work very well with bleaching either, because the underneath layer is the layer that's discolored.
So if someone has nice shaped teeth, they're in a good position and whatnot, take me through what laminates are. A lot of people hear laminates or porcelain veneers, but they don't quite know what those are. Could you explain those for us?
Sure. A laminate is a very thin layer of porcelain that can go over your teeth to change the length, the shape, or the translucency of the edge of your teeth. We can also change shade quite a bit with just a few laminates.
That's fantastic. And how do you decide how many laminates need to be done? How does someone know if they need 2, 4, 6, 32 laminates?
Well, when you do laminates, you want symmetry. You don't want to do one front tooth and not the other front tooth. Sometimes we will do that type of thing, but depending on how hard the tooth is to match. Also, when you're doing laminates, when you do 4 front laminates, that's a good setup. When you do 6 and you're starting to turn the corner of the mouth, that usually doesn't look good. So we try to stick to our formulas where we do 4 or 8 or more.
I know we were talking before the show that you said that your practice really, that cosmetic dentistry is more than just the teeth, that it really goes beyond that, then that part of your smile analysis includes other things than just the teeth. So can you just tell us a little bit about that as well?
Sure, David. We, with permission from the patient, recently I have done a lot with facial augmentation. Sometimes people develop thin lines and wrinkles, and we can use products, fillers, to augment their skin. We can also, as people age, when their lips get thinner, we can augment their lips. And we do it in different ways. And sometimes we try to just enhance their lips, and sometimes we try to change the shape. We also do some Botox therapy to, those little lines that'll come around your lips as you get older, and we can eliminate most of those.
So, and is that something that needs to be done on a regular basis, or is that one-shot deal and they're done?
The filler therapy, depending upon what type of material we use, usually lasts anywhere between 6 months and 2 years. But when we use Botox therapy just to mostly do from the nose area up, that has to be done every 3 or 4 months.
A common thing people ask me about many times is a gummy smile. A lot of times younger people, even older people, they smile and you see very little teeth and a lot of gum. What's that from? Can you tell us about that?
Sure. Sometimes people, as their teeth erupt and as they grow older, their gum doesn't recede properly. With other people, it could be just that their bone is shaped a little bit irregular. So sometimes we can use a diode laser. A diode laser is a laser that can use specifically for gum tissue. There's very little healing, and we can increase the length of the teeth by decreasing the gum tissue.
That's fantastic. We're going to take a quick break. I'm Dr. David Scharf. You're listening to Healthy Living Radio on WGBB.
This is Healthy Living Radio with Dr. David Scharf.
We're back now. Thank you very much. We're talking with Dr. Steve Rogers, a cosmetic dentist in Massapequa, giving us all sorts of great information. Dr. Rogers, one thing I see when I drive down the block, it seems like every dentist on their sign has their name and then it says cosmetic dentistry. So if I'm a patient and I want to enhance my smile, what should somebody look for in choosing a cosmetic dentist?
I think one of the first things to look for is how many cases they've actually done, and ask to see their photographs. Photos tell a story. Sometimes we even have testimonials, and we've even have some patients that have offered to speak to our newer patients.
So I can go into an office and it's not uncommon that I should say to the dentist, hey, can you show me some of your before or after photos, that sort of thing.
I think that would be a smart thing to do.
Yeah. Where do you find most of your cosmetic patients come from?
Most of my cosmetic patients come from previous patients. My office is probably 90% of the patients are referred from our own patients. We have a few patients that somehow find our website, and we have some that see our signs outside.
And if someone wants to come in and test the waters, do they have to get their smile makeover done right away, or can they learn about that and put that on hold for a while?
You know, David, we always offer consultation time. And we will provide consultations for no charge. If someone wants to come in and just talk to me about their teeth, I'd be happy to have them.
You know, I haven't seen them lately, but remember there used to be those makeover shows on television, The Swan or Total Makeover.
Yeah, they were fun, weren't they?
Or all those things. And, you know, these people would have their smile done and, you know, it would change their life. And do you see that? I mean, is that overblown, or when people change their smile, does it really make big differences in their life?
You know, David, people buy new clothing and it makes them feel good. People get a new coat and it makes them feel good. But when you get new teeth and it's the way you feel you should look, that makes the biggest difference. If I could just tell you about a patient. Recently, I treated a much older patient. She was getting ready to live at the Bristol. She came in and she wanted to do 8 laminates with me. I was a little bit concerned because here's somebody who's going to an assisted living place.
How old was she?
She was almost 80.
Okay.
So I asked if I could maybe meet with her daughter as well, and she said, of course. So I met with her daughter, and her daughter explained something to me. She said, you know, Dr. Rogers, there are certain things in life we can't control. When you have terrible arthritis and it hurts, you can't control it. When you have other diseases and a doctor says that you can take this medication, but we can't get rid of it, in this case, it gave this woman a sense of control. And when she was going to a new place, she would have the confidence to meet new people. So it was a very rewarding case.
That's great. What do people typically say, someone who had been ashamed of their smile or embarrassed or would put their hand over their smile for years, what do they typically say to you after they then finally get their smile made over the way they want? What kind of feedback do you get?
You know, often we see that with people who have had bad negative experiences previously. And it's unfortunate, but a lot of people who come to me will tell me about previous negative experiences. But when you can make that transformation from somebody who's shy or doesn't feel good about themselves and make them feel good about themselves, that is probably the best feeling.
And what's the youngest typically you'll see people that you'll do cosmetic dentistry on?
You know, David, sometimes we're doing just maybe a chip or closing a small space. So we're not doing a tremendous amount of work, and we're not doing work that's truly permanent. We'll do cases with young people after they've had orthodontics to help close their spaces. But the range is from 14 for cosmetic dentistry all the way through the seniors.
Do you ever see the shy little kid blossom suddenly? There was this dynamo inside when once the smile was fixed, the real kid came out.
I have a great story for you. I was treating a young woman. She was between 14 and 15. She had her braces off for a little while already, and she still had a space between her teeth. And she was really a shy kid. After doing 2 veneers from her parents called me up several weeks later. They were mad at me. The kid's out of control. She doesn't want to stay home, and she has a mouth like you wouldn't believe.
They don't know whether to thank you or...
That's true.
Or do other things. Do you ever get people who maybe feel almost guilty about fixing their smile? You know, they want to do it, but they feel like they shouldn't do it?
We see that a lot. Recently I had a case where a woman was older, and she said, you know, it's my time. And she came with her husband, and her husband didn't even realize how much his wife wanted that. When he saw how much his wife wanted it, he said it was no problem. Why didn't you ask me before? And that's common with dentistry. Why didn't you ask before? So as a dentist, we try to ask people, with their permission, of course.
Do people come in, new hairdo, new clothes, makeup all dolled up, lose 10 pounds? I mean, is that a pretty common thing?
Sometimes in my office, we even have fun with it. After we complete some cosmetic dentistry, we send them to a salon.
Oh, yeah?
So we'll have them all made up, and then we bring them back for photos.
That's
and
great.
Some of those photos are actually on my website.
Yeah, that's great. That's a nice thing. That's a nice thing. You know, something I get a lot of questions about also, I know you were telling me you have a lot of technology in your office. Tell me a little bit about some of the technology that you have, the cutting-edge stuff for doing cosmetic dentistry.
Sure. One of the newest things we have is a machine called a CEREC machine. Instead of taking an impression with the goopy material that dentists are so well known for, we can take digital images. Those digital images are then sent to a computer where the porcelain work is designed on the computer. There is no model. And then in our office, we have what we call a CAD-CAM machine. We take a solid block of porcelain, and we use a machine to mill out the crown. And that can be done in one appointment. So that's a big change.
So no more going home with the temporary in your mouth, temporary falling out, coming back, re-cement, 2 visits,
This is
getting
truly
numb
one
twice,
visit, all porcelain restoration.
get numb once, and they're done. And how does that hold up compared to the old types of caps, crowns?
You know, one of the things, we have none of the black line because there's no metal in these restorations.
Right. That's a very common question I get. People say to me is, you know, they point to a cap on a front tooth and they say it was good for a while, but now there's this black line at my gum line. What's that from? Can you tell our listeners?
Sure. Traditionally, crowns were done with a layer of metal and then a layer of porcelain over the metal. Today, when we do front teeth, we never use any metal underneath our crowns. There is no reason for that anymore. There are so many new materials that have the strength and etching and maybe a small amount of bonding, you can make a huge difference.
You know, a phrase that I hear a lot also, and I'd like you to explain to our listeners, is the phrase instant orthodontics. Someone says, you know, I've heard it on the radio. You can come in and have instant orthodontics. What does that mean?
Well, instant orthodontics can be a lot of things. There are some techniques today where they can really move teeth quicker than they could before. But I think what most people are saying when they refer to instant orthodontics is by adding and subtracting from their teeth with layers of porcelain, we can actually straighten out rotations and straighten out the positions of teeth. And I think that's what most people mean.
So instead of wearing braces for 6 months, a year with bonding or laminates, you can make them look perfect in, how long does that take? 1 visit, 2 visits?
Well, it usually takes 2 visits. The first visit, we put our temporaries on, and the second visit, we insert our laminates or veneers.
That's great. We're almost out of time. A couple quick questions. What's the most common cosmetic procedure people come in for? Do they come in asking for, I want this, this, or this? Or is it more, more interactive where you look at them and you make recommendations?
You know, the way we try to do things is, again, we use photography and we do a comprehensive exam. And I usually invite people back and I don't make my decision at that time. Then I take them out of the conference room, out of our treatment room into a conference room. And we use a big screen and we can really talk about teeth in a comfortable position.
And do they have options many times? Is there almost there's sort of an option for every budget most times? There's usually just one way to do the case and that's it?
No, there are absolutely different ways of doing things, from bonding, which is much less expensive, to veneers, which we can make greater changes and much longer lasting restoration.
Mm-hmm. And the big question on everybody's mind is how to fit it into their budget. So what do most people do who are having cosmetic dentistry done? How do they fit it into their budget?
You know, sometimes they finance it through a program called Care Credit, where they can extend their dentistry payments for over a 5-year period if necessary.
So it doesn't have to be a huge outlay on their part.
No, it doesn't, and we can fit their budget monthly.
Mm-hmm. What would you say to somebody who's sitting home listening and they've been hemming and hawing about having someone take a look at their smile and maybe they're embarrassed or they don't know where to start or they just don't know what to do. They've been on the fence for so long. What would you say to that person? What would be your advice?
I think the best thing to do is to ask for a consultation with a dentist. And keep it at a consultation so that you're comfortable and you'll know that nothing invasive is going to be done. And start with some photographs.
Do you find that most people are surprised when the process is over in terms of, do most people think it was going to be worse than it was?
I think that's most of the time. Mm-hmm. People always are expecting so much more.
Yep. And the other question on everybody's mind is how do they stay comfortable for all this? Is this painful dentistry to have this stuff done? Because if it's always good to look good, but if it has to hurt, you're not sure if you want to do it.
With today's anesthetic techniques and some nitrous oxide, there's no reason that people should be so afraid the way they used to be.
So you just get the teeth numb, do what you have to do, comfortable.
Yeah, and we develop relationships, and relationships are probably the most important thing because it's that trust. And we create a level of excitement. People want to do this.
And do people have to hide out while the work is being done, or can they go to work, be social, be out and about?
Our temporaries today are beautiful.
And are there temporaries when people have laminates done as well, or just for crowns?
No, we temporize all of our laminate cases as well.
And after someone has cosmetic dentistry, what do they need to do to protect that investment? How can they make it last as long as possible?
Well, continued hygiene and continued exams are definitely important. If anytime we want to find something, we want to find it as early as possible.
So what do you typically recommend? Do people have limitations in terms of what they can eat afterwards? Can they have tea, coffee, blueberry pie? Do they have to stay away from certain foods?
Well, with porcelain restorations, we really don't have to worry about blueberry pie or staining. Those things are pretty inert, and they really don't stain. There are some other types with bonding and stuff like that. People should be more careful. And as far as what they can chew, they can chew normal food.
Do you do any braces or any kind of orthodontics in your practice to help smile enhancement as well?
My partner, Dr. Jim Waltman, he does Invisalign. And that's been a great benefit to us. We can even use that in conjunction with some of our cosmetic restorations.
Yep. Maybe just tell us in the last 30 seconds what Invisalign is for people who don't know.
Invisalign is a series of clear, computer-organized retainers. They're totally invisible that you wear over time.
Maybe we'll have Jim on the show to talk about that next.
That would be great.
If you have any questions you'd like to send in to us, you can email us at healthylivingradio@gmail.com. I'm your host, Dr. David Scharf. You're listening to Healthy Living Radio, dedicated to bringing you the latest advances in health and wellness so you can live better, healthier, and longer. See you next week. Have a good night.
You're listening to Healthy Living Radio with Dr.
And that's been a great benefit to us. We can even use that in conjunction with some of our cosmetic restorations.
Yep. Maybe just tell us in the last 30 seconds what Invisalign is for people who don't know.
Invisalign is a series of clear, computer-organized retainers. They're totally invisible that you wear over time.
Maybe we'll have Jim on the show to talk about that next.
That would be great.
If you have any questions you'd like to send in to us, you can email us at healthylivingradio@gmail.com. I'm your host, Dr. David Scharf. You're listening to Healthy Living Radio, dedicated to bringing you the latest advances in health and wellness so you can live better, healthier, and longer. See you next week. Have a good night.
You've been listening to Healthy Living Radio with your host, Dr. David Scharf. Join us next week for another edition of Healthy Living Radio.